Good evening, everyone. For tonight's podcast, we're going to be talking about a good dog topic, it's compulsive behaviour. Now, this is actually something that isn't well understood, and it's actually the same with humans. There's a lot of parallels with human compulsive behaviour, otherwise known as OCD. And so I hope that I can break it down a bit and help you get a few ideas of how you can help. And also, if you want some extra help, how you can get in touch with me to find out more. So my name is Dr. Helen. I'm an emergency medicine doctor and also a certified animal aromatherapy specialist. And I love to help people with an integrative approach to their health and that of their pets. Now, if you like what you're listening to, please hit the follow or subscribe button so I can carry on creating more content, and let me know what you want to know about. Now, if you want to book a consultation with me or get an essential oil kit, then do check out my store, www.thehealthfuldoctor.com/store, or drop me a message to find out, we can have a chat about what the best options are for you. So let's get on with the show. Now, as I said, it is a difficult condition to diagnose, but also to manage as well. And so it is actually really important that we approach it from a holistic point of view, because otherwise we're not going to be successfully able to treat it, or even if we can't treat it, manage it. Now, a lot of the information regarding management does hail from the approach to the human condition obsessive compulsive disorder. Now, just like humans with the condition, dogs with CCD, Canine Compulsive Disorder, engage in repetitive exaggerations versions of normal behaviours to an extreme degree, often to the point of self-harm or significant disruption to their daily lives. And I've actually had a dog, my beautiful dog Toffee. She would obsessively lick one of her legs, and she'd get this what's called a lick granuloma, and it was a little sort of, I don't know, maybe about the size of a 10p piece, where it was just skin and raw skin that she'd just lick. The hair would be removed, and I always knew there was two reasons she had it. Generally it was because of frustration or pain. And frustration because she had some problems with her mobility, and if I ever saw her starting to lick, I knew that I wasn't meeting her enrichment needs or her pain. So by addressing those things, the problem went away. And that was quite a simple thing to do. Sometimes it isn't as simple. But excessive licking is certainly an example of compulsive behaviour, but there's also chewing or flank sucking, tail chasing or spinning, fly snapping, so snapping at imaginary flies, light or shadow chasing, pacing or circling, persistent barking, and pica, so that's eating non-food items. And so these behaviours are coping mechanisms. So your dog may exhibit some of these normal behaviours, but excessive in quantity and at an odd time is when it starts to become a problem. Now, my dog Seren, she used to open cupboards and counter surf, and she wouldn't eat non-food items, she'd eat loads of food items. And you could have said, well, that's a compulsive thing with her. But actually, when you actually looked at it, she just was a problem solver. She enjoyed the challenge of trying to work out how to open the fridge or get in these cupboards. And, if it would vary. And so I'd had child locks on several cupboards, and these other cupboards would be unleft, and they'd be unleft for months or years. And then she'd I think she was plotting, and then she'd slowly work out how to open it. And one video I'm really disappointed I never actually got, because I hadn't set Seren's kitchen cam up, was actually opening my Smeg fridge. She'd pushed all the books off the top of the fridge and had pushed open the door from the top. But I mean, she would do things like empty, if the slow cooker was on, she could get the lid off the slow cooker and lift the bowl out of the slow cooker and then eat all the food. But in context with her, although she is an anxious dog, this wasn't part of that. This was just her. She loves her food, and this was just a means for her to do a problem solving. And it wasn't due to lack of enrichment or lacking anything, because we could literally go ages. She didn't display any other behaviours. It was just really interesting. I caught her on camera, and it was just like, yeah, I'm just going to try doing that. But there's other times when dogs can do this, and it can be a problem. So she likes to shred cardboard, and so occasionally she will eat the cardboard. But again, this is something that's a very enjoyable enrichment behaviour for it. But if she was eating it to excess, then I'd be worried about it. So the behaviours, you will see them repeat over time, but they don't seem to have a clear reason and persist despite attempts to redirect them. So the definition of canine compulsive disorder is that over time, the stress or heightened state of arousal might lead to displacement behaviours. If this continues, these behaviours become compulsive. So just like in humans, as I've said, it is hard to diagnose, and it does actually tend to be a diagnosis of exclusion. So you must see a vet, okay, first and foremost. And any decent behaviourist will say you need a vet to review first. And that's certainly, if someone came to me with this, I would want a vet to have looked over the dog and to first of all rule out pain and things like that, because even spinning around can often be a coping strategy to pain. Some behaviours are repetitive and might resemble stereotypies, but others are not, and will be things like freezing. So things that are behaviours, like I said, might be spinning around, but then you get the freezings. You can also might see dogs that you think might be having hallucinations. So this is one non-repetitive behaviour. And dogs of guarding breeds and those selected for intense focus intend to exhibit this more, and maybe sometimes perceived as focal seizures as opposed to a compulsive behaviour. So again, this is something that the vet needs to have had a look at. Stargazing and fly snapping are under-recognised as compulsive behaviours, and they're often linked to pain, especially associated with the gut. And so treatment of potential gut issues may improve the behaviour as well. So the longer a dog has been practicing these behaviours, the harder it becomes to change. So why does it occur? Well, there's a variety of different sort of factors that can contribute to it. Early life experiences play a crucial role for the development of good mental health. So poor socialization can lead to compulsive disorder. Some breeds are more inclined to it. And although there has been found to be an underlying abnormality in serotonin and noradrenaline metabolism, environment, genetics, and neuropsychological components are involved. So there's so many different facets. Various areas in the brain are involved as well. So ones that are sort of involved in the regulation of repetitive behaviours, decision-making, and emotional processing. Serotonin is a neurotransmitter involved in mood regulation, impulse control, and decision making. And the research has shown that individuals with OCD often have an imbalance in their serotonergic system, but not always. Dopamine is another neurotransmitter that can be involved because it's involved with pleasure seeking and rewards, and it's possible that that system is linked there. And so there is a sort of research has shown that an imbalance between serotonin and dopamine may play a role. There's also the dysregulation of glutamate, which has been implicated. This is the primary transmitter in the CNS involved in, that's the central nervous system, involved in learning, memory, and synaptic plasticity. So that's your brain's ability to form new neural pathways. Gut health and nutrition has been found to play a significant role in compulsive disorders. And there has been found to be a link with gluten sensitivity as well, particularly in relation to fly biting or tail chasing. Also, an endocrinological link has been found as well, with cortisol positively correlated with severity of CCD. So that's the stress hormone cortisol. Cortisol can also be released with exercise as well. So it's not just as always straightforward as that. With there's been some research where they just were testing the cortisol, but it can rise with exercise. So it's a difficult one. So at the beginning, there is a normal behaviour which is a consequence of an improved environment, an impoverished environment, such as anxiety and fear or conflict and frustration. And often people don't recognise the licking or pica that might be dysfunctional. The terminology on compulsive behaviour is not clear, and so it can be difficult to ascertain where the limit is between normal and compulsive behaviour is. And the responses may be on a spectrum. So actually videoing these behaviours, it's really useful to show either your vet or your behaviourist, so that we can actually try and work out what it is. Is it a behaviour such as licking a paw because they're cleaning the paw, or is it actually something that isn't a functional act? Behaviours can be divided into different categories according to arousal levels. So low arousal behaviours are things like licking, which can lead to self-injury and alopecia, and flank sucking, whereas high arousal will be present in behaviours such as spinning, circling, barking, tail chasing, and so on. Addressing this needs to involve several areas, but firstly, medical causes such as pain or digestive problems need excluding. Consistency, creating comfort in routine helps your dog feel secure when there are anxiety-driven behaviours with a focus on rewarding good behaviour. The environment, so structured schedules such as feeding, playing, so that your dog knows what to expect. Interactive toys can be a game changer. Increase outdoor exercise. This is a mental boost. It gives your dog a way to explore and allows for aerobic exercise. Modifying the behaviour, so use a program of desensitization and counter conditioning and the use of behavioural interrupters to break the cycle, such as sound or a gentle touch. Relaxation training, such as deep breathing, settle, progressives, muscle relaxation. Use good quality chews, such as tripod pizzle or a bone, as a way for your dog to express emotions, because chewing is actually a modulator of stress. Now, it may be that meds are needed, but drugs such as serotonin reuptake inhibitors, which are a common first line choice, can take several weeks to get into the system. So essential oils can certainly play a role in here in helping as they get to work immediately. So either helping solve the issue in the first place or helping in some way until the medication kicks in. And different oils utilized will depend on the trigger and the behavior. So consulting a specialist such as myself is really invaluable. But essential oils that might be really useful, particularly the citrus oils, because they're great for promoting the release of serotonin and dopamine. But you've also got your calming oils, such as some of your wood oils like paper and guac wood, and obviously floral oils such as lavender can all be really valuable here. So if you'd like to find out more on how I can help you and your dog, please get in touch, find out about my consultations and how I can help. Don't forget to hit the follow or subscribe button. Maybe share this with someone who will find it useful. Got questions? Drop them below. And stay safe, stay well.